Hi, my name is Donna Smith. I live in Asheville, North Carolina, and I am submitting my week 3 video for the upper extremity mobilizations. Thank you for being patient with me as I have been quite overextended of late. My newborn baby is lying in the bassinet sleeping right now, and my 3.5-year-old is watching a movie, so we may be interrupted off and on here and then, but hopefully I'll be able to get through this so that I can move forward in the class. Thanks again for your patience though, Adrienne. And so I chose all the mobilizations, as you'll see with rationale, on the paper that I'll turn in. And I also know that there's a variety of mobilizations that I could have chosen. But I chose them not only for the purposes of the patient, but also those that I thought would be different types of mobilizations for me to practice for this particular exercise. And we'll begin now. Thank you. Okay, for this first shoulder mobilization, I'm going to do grade 3 into grade 4 mobilizations to address the stiffness at her shoulder. She has only about a 3 or less out of 10 pain. So I'm going to position her. She's just got about 15 degrees either way in terms of elbow extension and flexion. So I'll have that where her limit is and where she's comfortable. And fully support her arm. Wrap my hands around into a comfortable grasp where I've got my thumbs on the anterior portion of the shoulder and the lateral aspects of my index fingers on the back of the humeral head. And at this point I will perform PA oscillations, or larger amplitude, for grade 3. First, of course, I would have gone through grade 1 and grade 2, working up to grade 3, where I will do, for the sake of this exercise, 10 large amplitude movements into resistance. And then as I see that this is yielding and she's this is going well, I can hit into the end range or aspects of the resistance with grade 4 oscillations, where you have a small amplitude, a little bit more of a burst type oscillation right into the resistance. That would be the first mobilization. So this second of the 4 mobilizations I chose, again, to look at increasing the range in the physiological motions of flexion, extension, abduction, and the rotations, would be the anterior-posterior accessory movement, grades 3 and 4, like the first mobilization. And that's because pain really is not an issue, 3 out of 10, whereas stiffness is. So I've got the patient positioned as supine, like for the first mobilization, arm supported by me, and towards the end of her 90-degree limit in abduction right now. And I can also play around, I won't for the sake of this exercise, but I can also play around with the internal and external rotation at her limits. I'll come in and put my right hand over the anterior humeral head and my fingers over kind of her clavicle area. And then I will, after moving through grades 1 and 2, I'm going to go into grade 3, which is a large amplitude mobilization. It's 5 mobilizations there, or 5 oscillations there, where I'm getting into resistance. Is that comfortable? Mm-hmm. And then progressing, and I can again be playing with the amount of abduction I have and external and internal rotation, but then going into grade 4s, where I'm really just tapping into with short staccato type. Right here now I'm doing it staccato type oscillations of grade 4 right at the end into resistance. Okay. Okay, the next shoulder mobilization I'm going to do, in consideration of the joint stiffness, where stiffness is the primary issue and not pain, is a lateral movement, accessory movement. So I've got this towel here because technically she's limited to about 15 degrees either side of 90 in elbow flexion and extension. So I'm doing this makeshift as best as I can. But I thought this could be effective in terms of showing that position and still being able to do this mobilization. I want to get her up into closer to that 90 degree limit of shoulder flexion so that I can do the mobilization more effectively. So I have my left arm coming across the top of her chest, and I'm going to provide a lateral. So initially it would just be thinking about it, grade 1, and then grade 2, but really going into grade 3, where I have large amplitude lateral movement of the head of the humerus. And I'm going to be doing this as if she was in like a group 3B with some pain and stiffness. I could just move the elbow parallel to that. Or if she was purely into just stiffness without any pain, I could actually be moving the elbow more medially. And then from a large amplitude, like you see me doing now, moving into, at the very end and into that resistance, a grade 4. And then if pain does start to become a little bit of an issue, I could always back up into that larger amplitude, grade 3, and even back into 2 if necessary. Feel okay? Mm-hmm. Right. So the fourth and final mobilization for the shoulder, I was actually trying to think about what mobilization might be, very effective as my patient really comes close to the end of her physiological motion for the shoulder, especially in flexion, but for all, flexion, external, internal rotation. And the acromion, so I thought that I would do we'll move your hair just a little bit out of the way, a mobilization, a posterior anterior mobilization of the acromioclavicular joint. And what I will do is, first of all, the patient's supine with her arm at her side, her hand on her abdomen. I'll bring my thumbs up along the posterior lateral surface of the clavicle. There we go. Right adjacent to the AC joint. And I have my thumb pads there. Try to come down low so I can get that PA motion with the palms of my hands. I'm having a hard time with the height of this plinth, but I would probably raise it so I could get the heel of my hands underneath the posterior part of her shoulder a little bit better. The fingers comfortably along the anterior part of her shoulder. And then I would, using my arms, my body, apply a PA force up through the shoulders. So there's a grade 3 mobilization with large amplitude. How's that feeling?
Okay.
And then after moving into the resistance with these larger amplitude mobilizations, again moving into grade 4 where I have end range right into that resistance, staccato type oscillations. I kind of backed up there a little bit more into large amplitude. I need to hold it and not drift back so far. Keep that in a grade 4 mobilization. And hopefully this kind of opening at the AC joint would then begin to allow some more end range physiological motion at the shoulder. You feel all right? Mm-hmm. We said the first of 3 mobilizations for the elbow. I wanted to do a physiological movement instead of an accessory motion first. She has a lot of pain. I think it was about a 7 to 8 pain. So we'll be looking at a grade 1, working into a grade 2. I'm going to be working into elbow extension. So the first thing I would do would be to cup her elbow, and she's got about 15 degrees of extension away from 90 degrees. So I'm going to cup her elbow and forearm and really support it and get up here right next to her so that she feels like she's got good support and isn't having to brace or support her arm herself. Bring my right hand across the palm, right around across to the hypothenar eminence. Get good support at the hand and wrist so that she can really relax her arm. Is that feeling like you can relax? Good. And then instead of using just my arm like this, I'm actually going to keep that support behind her so that she feels it. Make sure that my grip around the elbow is very comfortable. I'm not squeezing. And then I'll use my body to just get that. Of course, grade 1 I would start out with is pretty much just thinking about it. I'd be watching her face, making sure that her trunk and upper shoulder and arm were staying relaxed, and then start moving into that more grade 2 mobilization for pain modulation. The textbook says that for this, about 20 to 30 degrees of oscillation is ideal. So my goal really would just be to see if we could start to get a little motion, large amplitude without moving into resistance, and get some pain relief. You all right?
Mm-hmm.
All right. For my second mobilization of the elbow, I'm going to do an anterior-posterior movement of the head of the radius, and that is because it's a very good mobilization to use when you have painful motion for elbow flexion or extension and supination and pronation as well. So I'm going to do first anterior-posterior, and then I'll follow up with the third mobilization for PA mobilization. So I'm going to have her actually in more of a supination, and I'm going to position her arm so it's resting on my hip alongside my trunk in a supinated position. And I could also easily just change that to pronation by moving the palm of her hand towards my arm. Then I'm going to find, I've got a nice muscle belly here that's very soft. I'm going to go in with my thumbs, make sure I'm on the head of the radius. And then be mindful not to really be using the flexors of my thumb, but be using my body to press through my thumbs in terms of the force. And got a little distracted by my dog there. Then I'll start out with just a grade 1, and if I see that she's responding okay, is it comfortable right now? Mm-hmm. So that just thinking about it grade, and then, which I really feel like does tell me a lot just about how the tissue is under my palpation. Then I can move into those large amplitude grade 2 mobilizations where I am certainly not going into resistance, watching my patient and making sure that she's comfortable. Looking at her trunk and arm, everything seems relaxed. I'm not feeling her pulling against me or anything. Does that feel all right? Yeah. So I'm doing repeated oscillations, large amplitude, grade 2, to address the pain that she's having. And also I could add in, actually moving her elbow into the available flexion and extension that she has as I'm doing these moves. Okay, thank you. We have one more. For my final elbow mobilization for pain modulation, going to do a posterior-anterior mobilization of the radial head. So I'm going to grasp her left hand, with my right hand. I'm in a comfortable position up against my trunk for a little extra stability, and have her in a little bit of supination. You can also do this with more pronation. I'm going to really have to squat down a little bit, just because I can't get this plinth up where I might want it. So I'm going to basically come in to that softened muscle belly, locate the radial head, get a nice comfortable grasp, just lay my fingers over her arm. And what I want to do really, so that I don't use my flexors of my thumb, is using my thumb more like a spring, apply like a horizontal adduction on my shoulder with a very slight pronation at the hand to get the movement that we're after. And I've got my thumb kind of in a distal pointing position. And so I'm giving, really just because of the pain, I will start with just a grade 1, so there's just thinking about it. That's kind of where I was finding the radio head, exploring there, watching for any grimacing, any signs of discomfort or guarding, and then just do a grade 2, so large amplitude mobilization, not into resistance. Are you comfortable? It's a little tricky to get that supination, but when I do get it, I really feel, you feel the difference when I get that supination. So that's the final mobilization. Okay, this is my third attempt to capture this because of a dog and a 3.5-year-old. So I am going to do the first of the 3 wrist mobilizations. The first being for the inferior radial ulnar joint with anterior posterior and posterior anterior mobilizations. So I have my patient's arm positioned in about 90 degrees of elbow flexion, relaxed basically against my trunk, my body facing her opposite shoulder, and I'm going to place my index fingers and my thumbs on either side of her ulna and radius, in about a midway position in terms of pronation and supination. And what I want to do here is move the ulna, I'll start with the ulna, posterior to anterior, and the radius anterior to posterior. And because stiffness is the main problem, not pain, I'm going to be really focusing on grade 3 to 4 mobilizations. This is a good mobilization for people post-fracture and a period of immobilization, good for restoring supination and pronation. So for like that group 3B and 2 type patient. So got my fingers also supporting excuse me, her forearm, and I'm going to apply get into the resistance after I feel through beginning, mid, and end range, like with all mobilizations. But I'm going to be going into grade 3, so I'm doing posterior, anterior, grade 3 large mobilizations, the ulna, anterior, posterior, of the radius. Then I can move into grade 4. And here, like when the first time I tried it, I really like faster, and it seemed like my patient likes that faster grade 4. Is that right? That feel good?
That's good.
A more rapid staccato, right at end range, or in terms of resistance. And then if she did start to have some, kind of pain or discomfort, I could always back into that grade 3 and into grade 2, even large amplitude, just to bring about some relaxation to the entire forearm, just because she's got this multi-joint issues going on and all the pain in the elbow. I might need to back up and get into relaxing grade 2 large amplitude mobilization. Good? All right, thank you. All right, for the second mobilization of the wrist, this is a radiocarpal anterior posterior accessory movement. I'm going to take the patient's hand and hold it firmly, grip her left hand with my left hand, get her thumb in a comfortable position. Does that feel good, that grip? And so my goal is to move the carpus relative to the radius, and this will be grade 3, grade 4 mobilizations in order to advance the range into that stiffness. So I'm going to bring my thumb down just below the distal head of the radius. Bring my fingers around so that I get a good, comfortable grip, and then facing away from the patient, so I have a nice, stable hold of her arm. Does that feel comfortable? I'm going to basically move my forearms opposite one another to get that movement. So I'll move through 1 to 2 and then into 3, large amplitude, into resistance. Definitely using, I have to bend down a little bit more here, using my arms, shoulder girdle, to really get this motion. And then after there are about 10 grade 3 larger amplitude movements, I'm going to hit right at the end into that resistance, small amplitude oscillations of grade 4. Does that feel comfortable?
Mm-hmm.
Notice that I'm tensing my shoulders up a little bit, so I'm going to really try to drop my shoulders, bring my scapula back down, and that feels better to me. There, good, thank you. Okay, and for my final wrist mobilization, I'm going to the patient's position supine, like for all the other mobilizations, and I've got her in a relaxed position. I'm facing her with her arm basically relaxed on me, and I have, as with all the other mobilizations, prepared her before doing this, what the position would be like and what to expect. And what I'm going to do is basically perform anterior-posterior mobilization of the intercarpal joints. Of course, you can do multiple joints, and I'm going to just choose the two that are actually pictured in the textbook, but also just because I think dealing more with the articulation with the radius and ulna as well, really looking at trying to open up that wrist flexion and extension. And so I'm going to put my index fingers back behind and my thumbs on the anterior portion, find, there we are right there. And is that comfortable to you? Yeah. So really working on stiffness. This is a great mobilization for stiffness after injury and immobilization. Definitely coming at this using my arms rather than just my thumbs. And so I'm going to move right into grade 3. There we go. Large amplitude. So each moving relative to the other. And after performing about 10 of these grade 3 mobilizations, I can really get in there at the end of that resistance with a much smaller amplitude. Again, seems like this feeling good to get a nice, more rapid, small amplitude mobilization of those intercarpal joints, grade 4. Great, thank you.